Thriving communities.
The views expressed on this program do not necessarily represent those of Revive FM or its management.
Bismillah ar-Rahman ar-Rahim. Very welcome, ladies and gentlemen. This is your host, Muazzam Ali Sandhu, and you are listening and watching Your Voice with Muazzam Ali Sandhu. This is our weekly show. And in our show, as you all know, that we always try to highlight the concerns of the community, the people's issues, the issues of the society and the general member of the public who are facing. Ladies and gentlemen, nowadays, there is only one debate going on in all over the country as well as internationally in relation to the issues facing by the UK residents. That is continue lockdown, the vaccination programs, and also the new rules implemented by the British government, which is applicable to all those people who are going to travel from international to the UK, from anywhere from the world. Whoever is coming to UK, whether or not they are British citizens, they must follow these rules, and there is very high prosecutions, punishments is also applicable if anyone is committing any offense and breaching those rules. And ladies and gentlemen, we will discuss the vaccination programs, how the government's vaccination program is going on, and what is their next outline and what is their next project. Also, we will highlight in today's show illegal migrants, how they are being treated during this lockdown, and whether or not the government has any agenda for those illegal migrants in order to give them vaccinated. I know that they were previously offered the equal service for the coronavirus treatment as well as the testing service. Ladies and gentlemen, to discuss all of these things, we have our distinguished guest with us today who are joining today's show. That is a very vibrant discussions that will be very informative and the community guidance in our show. Please keep tuned and keep listening this show till in the end. Please welcome Councillor Qaisar Abbas.
Thank you, Muazzam Bhai, and thank you, Revive Radio, for having me on your show.
Thank you very much, Qaisar Bhai. You are always a very vibrant and active member of the community. You remain in contact with the vast majority of the community members through all the walks of life, whether they are Minister of Religions, whether they are the ethnic minorities. You are also the ethnic minority officer in the West Thurrock Council. Councillor Qaisar, we will discuss today the various aspects of the lockdown crisis, the issues UK residents are facing. How do you think that, how far we have progressed so far?
No, thank you once again, Muazzam, for having me on your show. This is very kind of sensitive issue at this stage, and as you have rightly said in the start, this is the topic which everyone is discussing, the COVID, the vaccination, the new rule, the lockdown, when is going to be over, and what is going to happen, the people who are coming into the UK. So there are a lot of things, so obviously this is creating a lot of panic and, mental stress to everyone. And as this is going on, we have seen this personally, people have suffered mentally, people have lost their job, people have lost their businesses. And obviously, all this is adding up, to the stress which is due to this COVID. And obviously, the ultimate solution is following these rules and adopting to these vaccinations. So obviously, there are a lot of rumors, within different communities, and particularly within BAM communities.
Exactly.
So we, you have rightly said in the start, this is our duty, moral duty, to highlight these issues and to make sure these rumors, they die down as early as possible. And we need to encourage people to come forward and do this vaccination.
Do you think that there are still people who don't believe in coronavirus?
Uh, there are a lot of people, not just here, not within just BAM communities, within other communities as well. A lot of people, there are rumors. People, they say, oh, this is hoax. Obviously, this was much more. The rate was much more higher in the first lockdown, but now people have realized, no, this is serious. No government wants their citizens to die. And plus, like, if you see this, or if you have witnessed this, like, I don't personally, if I recall, I every day I kind of, like, receive messages of 3 4 different people who have died from COVID, and within different communities. I think, like, every there is no one here in UK or anywhere else whose family members or friends haven't been affected with COVID or haven't been died. So you can see the impact of this coronavirus is everywhere. Everyone is affected. Lot of people, they have died on, even here, it's 115,000 plus people have died because of COVID. And though these figures are of those people who have died within 28 days of contracting COVID. So people who have been been affected with COVID longer, they are not, they included these figures. So maybe the actual figures are far higher than 115,000 pounds. So there are people, but we, as a responsible citizen, we
115,000.
don't need to listen to these rumors. We need to listen to our scientists. We need to listen our medical experts. We need to listen to our health department and to follow their guideline, not to those hoax, not to those
Exactly.
so-called videos or so-called messages.
Yeah, but Mr. Qaisar, can you tell me that why there are conspiracy theories every time? This is the biggest problem of the world, that people always trying to sabotage the whole campaign for life saving. People always go against that, and there are so many propaganda and fake news being circulated, many people spending their lot of life, even they're putting themselves in danger. I saw many people, they put themselves in danger. They went to the hospital during these days. They're trying to record the video messages showing the people that what is happening in the hospitals, and they're misleading. They are trying to convince their own family members, all the rest of the communities, that there is no such a coronavirus. NHS is lying, government is lying, everyone is lying. So why these people are not properly handled? Because this is a serious matter. We lost more than 115,000 people's life.
You're absolutely right, because we have seen this, like, whenever there is something, there are always two sides of one coin. When there are people who realize, like, the severity of this pandemic or any other issues like this, and then at the same time there are some conspiracy theorists, who have their own theories. They take everything, different point of view for everyone. Obviously, every human being is different, so they have different point of view. But some people, they take negativity out of every single thing. So for instance, you have mentioned in hospitals, so some people have shown some videos showing, like, empty beds there, and they are portraying, look, the hospitals are empty. So all these, whatever NHS or government they are saying, so this is fake. But actually we need to realize this: when this pandemic was over, so they have suspended the operations. So there are different wards, there are different departments in each hospital. So for instance, if someone will go in this stage in kidney department, for instance, so obviously he will find less people in that department
Exactly.
and
Yes.
more people in other departments. Obviously there are less, for instance, operations, there are less, for instance, there are, if you go to dentist, there are less appointments, far more less than, previously. So if someone goes and say, look, the dentist is empty, so this is not an excuse to say, like, no, the COVID is hoax. So we need to realize, when people are dying, government has shut down everything, all the shopping centers, all the markets, even the departments are closed. A lot of people, they are working from home. So if the government has some benefit from this, or NHS has some benefit from this, So what benefit are they getting? Are they happy if people are dying? Are they happy if the economy is suffering? We have seen, like, that this is the worst uh, 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 fall down in economic GDP. So no government wants less money or their people to die. So we need to realize, as a citizen of this country, or as a human being, that this is our responsibility to listen. Like, for instance, if a doctor, he has like 5-6 years qualification, then he become doctor, and then
Yeah.
the scientists, they do a lot of research, and then they come up. And some people, they are just sitting and doing some googling, and then they say, look, this is hoax, this is not right. So obviously there are people who catch those easy because they feel like, okay, this is something, oh, something is fishy going on. So it is very difficult, obviously, to make sure 100% people, they are following these regulations. As you have heard in different news, like a lot of people, they are still doing partying. They are doing
Yes.
like in-house parties. They are meeting up. They are going outside. They are doing shopping. So they are not maintaining social distancing. But at the same time, if you ask them, someone has contracted COVID, so can you go and see them? So they will say no. And one side, they are saying this is hoax, but on the another side, if someone died because of COVID, no one is even willing to go to their funerals. So these are double standards. So we need to
Yes.
being a responsible citizen, we need to differentiate between these things. What is for the safety of us,
Exactly.
and what is,
This is the right forum, and exactly the objectives of our show, that we denounce all of these conspiracy theories. We denounce all of these fake
exactly.
news and any propaganda against any pandemic, of this pandemic, which caused us a very heavy loss during this 1 year. Being a community leader, I want you to give a very strong message to whole of the community that do not listen, then we will move forward. Please.
Thank you. As obviously this is very, very important.
Even we
For
can use
instance,
our own
like
language.
even
अपनी जुबान में भी बात कर सकते हैं कि लोग समझ सकें कि इसको सीरियस लेना है.
you're absolutely right, Maz. We need to take this very, very seriously. And this is not just within BAM communities or Muslim communities. As maybe you have read today's Sky News report, even like, they have uh, took some, I think, interview of Maulana Cllr Qaisar Abbas and some other imams. So they have said, look, this vaccination is halal, and if there is a kind of treatment for any disease, so we shouldn't like refuse that treatment just because of some conspiracy theories. और
Yeah.
दूसरा आपने बिल्कुल सही कहा कि मैं उर्दू में भी उसको बिल्कुल ये कहना चाहता हूँ कि हमारे जितने बहन भाई हैं, वो बेशक जो भी हमारी लैंग्वेज समझते हैं, कि ये कोई इस्लाम या किसी और मजहब की जंग नहीं है, ये इंसानियत के बचाने की एक जंग है. ये जो वैक्सीनेशन है, ये किसी एक कलर या किसी एक मजहब के लिए एसोसिएट नहीं है. इससे अगर कोई एक बंदे को, ये इंसानों की एक ऐसी बीमारी है जो इंसानों को इंसानों के जरिए से लग रही है, और अगर आप इसकी वैक्सीनेशन नहीं कराएंगे या इसकी एहतियात नहीं करेंगे, तो इसमें कोई भी आ सकता है. अगर आप देखें गार्डन ऑफ पीस में जाके, या बाकी जो जितनी मुस्लिम सेमेट्रीज हैं, वो भी उसी तरीके से फुल हैं जिस तरीके से बाकी सेमेट्रीज हैं. तो आपको ये चीजें समझना कि शायद ये हमारे लिए नहीं है, या ये हराम है, या इसमें ये चीजें हैं, या इसमें काफी लोग कह रहे हैं कि शायद उनका डीएनए चेंज हो जाएगा, या इसमें कोई ट्रैकिंग डिवाइस है. ये अगर आप उसकी देखें वैक्सीनेशन, तो ये एक छोटा सा इंजेक्शन है. तो इसमें ऐसे तो हो नहीं सकता कि वो कोई चिप आपके अंदर इंसर्ट कर दें. ये देयर आर फ्यू ड्रॉप्स जो आपको लगेंगे. तो ड्रॉप ऐसे हो नहीं सकते कि जो आपको ट्रैक डाउन करे. और वैसे भी जिस तरीके से अभी सोशल मीडिया आपके पास ये सारे मोबाइल फोन्स हैं, इनके ऊपर आप ट्रैक डाउन वैसे ही हो रहे हैं. अगर आप कोई चीज सर्च करते हैं अपनी यूट्यूब के ऊपर या फेसबुक के ऊपर, तो आपको उससे रिलेटेड सारी एड नजर आना शुरू हो जाएंगी विद इन फ्यू सेकेंड्स. तो आप इन चीजों को, ये कंस्पायरेसी थ्योरीज हैं, आपको चाहिए कि इनके ऊपर ध्यान ना दें. कोई आपको ट्रैक नहीं करने जा रहा. किसी को आपको ट्रैक करके क्या मिलेगा अगर आपने कुछ गलत नहीं किया हुआ. तो आपको बीइंग इंसान, being a मुसलमान, being a पाकिस्तानी, being एशियन कम्युनिटी, हमें इस चीज़ों को अपने और अपने ख़ानदान को आगे लेके आना चाहिए। वैक्सीनेशन करवाएं, जो NHS की हदायत हैं उसके ऊपर अमल करें। कितने लोग हैं जिनको हमने देखा हुआ है कि मर गए। और दूसरा एक इम्पॉर्टेंट बात है मोहसिन साहब, मैं रिवाइव रेडियो के तवस्सुत से वो कहना चाहता हूँ कि गवर्नमेंट ने बड़ा ओपनली ये अनाउंस किया है कि ऐसे लोग जो अनडॉक्यूमेंटेड हैं, जिनके पास वीज़ाज़ नहीं है,
Yes.
अगर वो लोग ये सुन रहे हैं तो उनके लिए ये वैक्सीनेशन फ्री है। और दूसरा ये है कि उनका वो कोई रिकॉर्ड नहीं रखेंगे। अब ये सी वो नाम वगैरह तो पूछेंगे क्योंकि उन्होंने वैक्सीनेशन लगानी है, फिर उसकी दूसरी डोज लगानी है, लेकिन वो ये कह रहे हैं कि हम कभी भी ये जो इन्फॉर्मेशन है वो होम ऑफिस या किसी और डिपार्टमेंट के साथ शेयर नहीं करेंगे। तो अगर आप उस कैटेगरी के अंदर हैं, ओवर 50s हैं जो अभी उन्होंने स्टार्ट की है, या ओवर 65 हैं, तो किसी भी जीपी से आप उसको कॉल करके अपना नाम बताएं और उसको कहें कि मेरी एज इतनी है और मैं वैक्सीनेशन लगवाना चाहता हूँ, तो आप जरूर आगे आए। इस डर की वजह से आप पीछे ना रहें। हो सकता है ये डर जो है ये किसी की जान ले ले।
बहुत जबरदस्त आपने बात की है। बेशुमार कैसे साहब यहाँ पे इलीगल माइग्रेंट्स हैं जो यहाँ पे रह रहे हैं, दे आर लिविंग देयर मिजरेबल लाइफ, दे आर सफरिंग कोविड-19। बेशुमार बिजनेसेस बंद थे और वो तो ना उनको फरलो, ना उनका कोई पब्लिक बेनिफिट्स और ना ही सेल्फ एम्प्लॉयमेंट स्कीम। They do not have any single kind of the financial support and they are under the very serious and miserable conditions. आपने बहुत अच्छी बात की कि वो उनको चाहिए कि वो स्टेप फॉरवर्ड हों और अपनी वैक्सीनेशंस के हवाले से किसी किस्म का कंप्रोमाइज ना करें। गवर्नमेंट give you full surety that they will not take any kind of this single action against an illegal migrants if they have if they are living in the UK or during this UK they do qualify for the vaccination program. कैसर साहब, वैक्सीनेशंस के हवाले से बताइएगा कि कौन कौन सी कैटेगरीज जो 15 million the government is celebrating actually one of the biggest achievement that during this 1 month or 2 month from दिसंबर से उन्होंने शुरू कर दिया था, लेकिन एक्चुअली जनवरी और फरवरी मिड तक 15 मिलियन टारगेट्स उन्होंने किए। तो उनमें से कौन कौन से लोगों को वैक्सीन हो चुकी है? एंड स्टिल आई वाज लिसनिंग द न्यूज़ दैट देयर आर hundreds of thousand people that do qualify under the first program but they haven't vaccinated properly. तो उनको क्या करना चाहिए?
जो ये तो पहली जो थी वो अभी सी देवर फॉर ओवर 65 और जो की वर्कर्स हैं उन लोगों के लिए है। तो obviously this is a big achievement, you know, achieving this
over
on
65 या over 70?
I think it was over 65.
Okay.
If I'm not wrong. Yeah, it was over 65, but next phase is over 50. So इसमें जितने भी लोग आ रहे हैं, obviously ये एक बड़ी 15 मिलियन लोगों को ये लगाना विद इन शॉर्ट स्पैन ऑफ टाइम, ये एक बड़ी अचीवमेंट है। लेकिन इसके साथ साथ अगर आप देखें ना कि जिस तरीके से लोग बाहर से आ रहे हैं और उनके ऊपर वो जो चीजें हो रही हैं, तो वो चीजें उसी तरीके से स्प्रेड भी हो रही हैं। तो ऑब्वियसली जितने ज्यादा लोग को जो वैक्सीन है वो लगाई जाएगी, उतनी ज्यादा सब बाकी लोगों का भी तहफ़्फ़ुज़ होगा। ये तो नहीं हो सकता कि दे हैव वैक्सीनेटेड 15 मिलियन, सो व्हाट अबाउट अदर millions of people who are obviously they will be going out, they will be mixing up, you know. So if one person is like protected and then 10 or 15 people around him they are without vaccination or they have these symptoms, so obviously it's very difficult to control this corona. So this is our responsibility, everyone's responsibility. So whenever our turn is, we should come forward and get vaccinated.
Okay, for example, the 15 million people, the first 5 categories which the governments were targeting to vaccinate them. For example, many of them still haven't vaccinated due to any reasons. Maybe they are still not believing it. Maybe they are misguided by their family members or anyone around the community. Maybe they are feeling scared or they feel uncomfortable, or maybe they haven't been invited by their GP or NHS. So in any event, for example, if they haven't been invited by the NHS or their GP, what action they should do?
So what they can do, if for instance, if someone is eligible, they haven't received any call or anything, so what they can do, they can contact their local GP or
Yes.
NHS So then obviously they will guide them, or they can book their appointments whenever their turn is. So if there is someone who feels he or she was eligible and they haven't been invited for vaccination, so they should contact their GP as soon as possible. And if they are undocumented people, they are not registered with GP, so they can call any GP, or they can contact NHS helpline, so they will be able to help them in booking their appointment for vaccination.
Right. Ladies and gentlemen, the GP is the main contact, the first source of contact. If anyone need to, they are waiting for their turn and they haven't received any invitation, they must contact the GP. Or if they still haven't received it, they should. वो NHS का एक हेल्पलाइन है जिस पे वो कहते हैं कॉल कर लें, वो भी जरा प्लीज शेयर कर दें.
Sorry, I think that everyone must have their GP numbers, and NHS number. They can just call standard NHS number. I'm not sure either is 101 or 111. I can just double check this, and then I will share this with you later on.
Yes. So, कैसे सब मुझे ये बताएं कि still there are a few communities, they are working on Frontline, they are at a very risky stage, they are struggling. For example, the police officers and the teachers, why they are not under that group, and why the government is and the vaccination program is not focusing on those people. For example, police cannot avoid to remain in social distance if they are raiding someone's house, if they are trying to arrest criminals, handcuff them, put them in a van, they are traveling in one van. उनका वो different households से लोग हैं एक van में या एक कार में 4-5 people are traveling in one car. तो पुलिस को तो वैक्सीनेशन प्रोग्राम अभी ऑफर नहीं किया. And there is a news from the Scotland Yard that nearly 5 police officers so far has been died due to the coronavirus. So this is the biggest concern.
Obviously, this government response hasn't been kind of ideal, when coming to kind of like protecting these key workers. So if you see, this pandemic is obviously this corona, we have heard this from last December 2019. So obviously this government took so many months to implement even the initial kind of precautions. So they haven't done anything until March. So obviously this was it. It helps in spreading this COVID at very fast speed. So if you look into kind of, for instance, just people who are arrival in this country, so they have just started this hotel quarantine just on Monday. So this is, you can see, even it took them 1 year to implement this just hotel quarantine. While other countries, for instance, if you go to Pakistan, the first thing what they will do is, once you have checked in, if you have passed this immigration, then what you will do, they will take you to a facility within the airport where they will do your test. So you will get a result. If your test is negative, then you will be allowed to leave the airport and go home. Otherwise, you have to quarantine. So even the countries who are third world countries, they have very robust system in place. That's why there are very low death rate in those countries. While in this country where the population is around 65 million, 115,000 people have died. So it means there wasn't enough kind of measures to protect these people. Obviously, frontline workers are one of those. Teachers, whether it's NHS staff, either they are police officers or shop workers, they should be given priority, to obviously they are there to protect us. This is their job to be out, as you have mentioned, they are traveling. Obviously, they have to travel together, in vehicles, or if they are raiding somewhere, some places, so they have to go. For instance, recently they've been to a club and more than 100 people were there. So obviously, when they, even though they have, for instance, protection, and if they are going to raid somewhere where 100 plus people are there, so obviously they themselves are at risk. So this is, I think, government should do more and do this prioritized vaccination program for these key workers,
Exactly. So the vaccination minister of UK, Nadeem Zahawi, I was listening his briefing yesterday, wherein he was putting all of the vaccination programs to the NHS and the vaccination scientist. But actually, the government is not running by the scientists and the vaccination researchers. The government is running by the Conservative Party. Nadeem Zahawi, the vaccination minister, he is directly responsible. The Boris Johnson, the Prime Minister of UK, and his whole cabinet, and the responsible health ministers, they are directly responsible that to prioritize the groups of vaccination people. But why the hell on earth the minister of vaccination saying that this is not his duty, and the related vaccination scientists are looking onto it, whether the police officers and the teachers should be included in this group or no? Why the government is not taking any initiative for that? The police officers are dying. While they are talking, the police officers are dying.
So you are absolutely right. Obviously, that there are government failures, but honestly, I'm not sure either they have been vaccinated, the police, or not.
No,
But
this
obviously,
is not in the
Nadeem,
list yet.
Nadeem Zawabi is the person who is responsible, and his portfolio is just to look into vaccination, So that is ultimately his responsibility to make
Exactly.
sure people who are at the forefront, people who are protecting us, people who are in these key posts, so they should be vaccinated at a priority. So if he's saying like, no, okay, certain person should do, okay, if he's saying like, no, okay, you should listen to scientists, then they are the ones who should have been listening to these scientists. They should be the one who should have been listening to these medical experts. So there is clear evidence, like they were advised on early lockdown. They have been advised on different measures which government
Didn't.
did not follow those things. So obviously, ultimately, because of those failures, people have died, people have suffered, businesses have suffered, a lot of families, they have suffered. For instance, if one person is died, it's not just one individual. There are whole family system that has been disturbed with this one fatality. So no one can say, obviously this is government's responsibility. We understand this is very difficult to vaccinate every single person, at the same time, but obviously they should prioritize people who are more vulnerable, people who are at fronts, especially these key workers.
Yeah, the Nadeem Zahawi's just recent statement I'm reading on the Sky News, it says that the government is battling a tsunami of the disinformation when it comes to coronavirus jabs. The vaccination minister has told to Sky News. So we were just talking about that. There is a lot of disinformation. There's a lot of battle going around within the communities. There are many active members who are involved to spread the disinformation and misguiding the people. I know that this is a very important role. Equally, the community leaders, the politicians like you, the councillors, all of the influential people who are living in this society, and they do understand that the vaccination is equally important. They must play their role. Qaisar, can you please tell me one important thing? As you earlier mentioned that in UK, they recently introduced a new program to quarantine the people in a hotel. First of all, let's talk about the hotel one. Then we will discuss about the new rules, the day 2nd and day 8 vaccination, and how what are the good things and bad things within that. So in the hotel one, the one issue I had with the government policy, they planned for quarantine for certain countries, for example, the South Americans, the red list, they must quarantine there in the hotel. They book their things, tickets or positions in the hotel, reservations, everything. I think that is also very expensive, 1,700 something. That is one point. The second point is the moment they launched these rules, this after few minutes, the all the reservation and booking was finished. So why the government has made such a big blunder that the minutes after they launched the new rules for quarantine, all the bookings finished. I mean, wasn't there any cabinet member or any government minister or any responsible persons or vaccination ministers, Nadeem Zahawi or Boris Johnson or anyone who should say that, listen, I don't want this system get crashed. I don't want this system get overbooked or overloaded. I need a plenty of space, plenty of vacuum, and plenty of rooms or hotels or anything must be available for, because people are traveling from worldwide. But unfortunately, the minutes after the rules launched, the whole system crashed. There wasn't any booking available. It was all booked. So why this happened?
Actually, this is not just with their new quarantine hotel rules. So whenever this government has said something, at the same time, different ministers, they have contradicted their policies, at the same time. So it has always been very confusing. Whenever, for instance, if Boris Johnson is saying something, so the another minister will say something else. So, and then another minister will say something else. So there has always been a confusion, and this confusion has led to more deaths. This confusion has led to more fatalities. This confusion has created more panic and more mental stress within the people. So obviously, this is government's responsibility. Whenever they make some policies, they need to make sure the proper resources are there, the system is in place. So for instance, this is like, for 10 days, if someone is coming from those 31 countries, so they have to pay individually £1,750 per person. So obviously 1,750, this is a lot of money, and within this what they will get, just a room and 3 meals. So what else? How, if they have to, even in today's reports or yesterday, some passengers, they are already complaining. They are saying, look, if they are buying extra water or another drink, they have to pay for it. So just say 1,750 plus on top of this there is extra money. So obviously, the government has to protect its citizens, from these kind of diseases, but at the same time they need to make sure the impact on those people who are being affected, that is reasonable, that is proportionate. So they cannot have like very high rates. We know, like, there are these rooms, they are much cheaper normally if you book them on normally on any website. So obviously these rates are very, very high. So it means like, people are being penalized for government's failures. So this is government responsibility, ultimately, whatever decisions they are making, so they are responsible for their failures. So when they are claiming like 15 million jabs, they are their success. At the same time, they need to accept, so where they made these failures, they need to investigate these. There should be an inquiry into these 115,000 plus deaths. So there should be an inquiry in like whenever they made these kind of new regulations, those regulations, the confusion among those regulations has led to more deaths. So there should be a clear inquiry into these failures.
Yes, there is a big campaign actually going on.
Exactly.
The public inquiry on the big number of deaths, the mishandling of the coronavirus, the public inquiry on the technical terms they are going to use, within 28 days, and what is that actual figure is much higher. Why the government is not sharing the actual figure on the every death certificate which says that the COVID related death. So the government is not sharing that data, and there is a public inquiry. Do you support that public inquiry, Mr. Qaisar?
Of course, and there is no kind of shame even for the government, or there is nothing wrong. If, for instance, if there is something, the lessons can be learned from these inquiries for any further pandemic, or if in the future something comes up, so we need to be better prepared. So obviously inquiry will help, like, where things went wrong, how things went wrong, and what could have done, like, to safeguard our people. So we have example of New Zealand and other countries where they have successfully contained this virus and they have controlled, and obviously ultimately they have saved thousands of lives. While in UK and in USA, we have seen far more deaths, because of these lack of proper and on time rules and regulations. So obviously this if then the government, this is government's responsibility. If they are transparent, if they feel they have done nothing wrong, so they should be open up, and they should kind of form an inquiry, and then this should be investigated properly and fairly.
Exactly, Mr. Qaisar Abbas. One thing which is very alarming and concerning, that the punishment the government introduced in their new rules, that if anyone breaching those new rules, people coming from internationally, they must, number one, they must have a COVID negative test in hand before traveling. Number two is the need to book their day 2 and day 8 test, that is costing £210 for one person. And number 3 is the need to tell that whichever country they have traveled from in last 10 days, and any misleading, hiding, or any false informations will be dealt with very iron hand. And the government implemented the fine up to the £10,000, also 10 years imprisonment. So what is your
Obviously, that they should be kind of fine or those kind of things, but sometimes the government has gone too far, when coming up to these kind of things, so we need to realize, like, implementing these kind of things, obviously, there should be kind of like punishment or fine for those people who violate these rules. Obviously, if someone is violating these, they are risking their lives, they are risking everyone else's life. But at the same time, government, all these rules and regulations, they should have a rationale behind these things. For instance, if this is not people's fault, because if this has spread at a faster speed, so this was government responsibility. So they should have kind of a proper mechanism in the start, rather than having it took almost 1 year to this government to implement these rules and regulations. So if they should have done these things far earlier, for instance in last March. So what happened in last March, April, May, then in June, July, they introduced another scheme, Eat Out. So obviously they were encouraging people to go out, and it obviously helped in spreading this virus. So ultimately this was going on and on and on. If they would have contained at that stage, so they should have been, like, contained by now. But obviously now this is the people who are paying the price for government failures. These
Exactly.
are the normal people who are, for instance, if someone is going in these conditions, they are not going on holidays. There are some reasons, the people are traveling. For instance, their family members are not well, they are attending some funerals, or they have some work commitments. So people who are going there, yes, there could have been different mechanism. They can ask them to self-isolate in their homes. They can track their mobile phone, or they can ask them to provide their COVID test. For instance, if someone is coming into this country, they have to provide COVID negative test, PCR, within 3 days of traveling. So they already are tested negatively. So what they can do, once they are here, they can do their another test and see if they are negative or positive. And if they are negative, still they can say, okay, you can self-isolate for further 5 days, or you are free to go or do this test another 3 days. But keeping them in a hotel and then charging them a lot of money, so this is obviously bringing extra burden to these people who have been out for something very urgent. So obviously everyone has their concerns. Government is there to protect them, but these whatever punishments or fines they are doing, it has to be reasonable.
Yes. कैसे साहब, मैं चाहता हूँ कि थोड़ा सा लोगों से जो न्यू रूल्स हैं इंटरनेशनल ट्रेवल्स के, वो भी शेयर कर लिए जाएं, कि न्यू रूल्स गवर्नमेंट के ये हैं कि everyone who is coming from anywhere of the world to the UK, whether or not they're British citizens, they must need a negative test for travel, number one. And number two is that they need to book a day 2 and day 8 test, which is costing £210 for one person. Second thing is, अगर कोई भी बंदा जो मनी अफोर्ड नहीं कर सकता, पैसे अफोर्ड नहीं कर सकता, there is a financial support available, that is a, you can say, a loan from the government which need to be paid back within 12 months installments. और दूसरे नंबर पे यह है कि उसने बताना है कि wherever he is going to live, the number he need to share, from which countries he was traveling from in last 10 days. ये मेरा ख्याल है ये जो इन्होंने कैसे सब ये जो ऐड किया है the 10 days का कि अपने 10 days history बताएं, travel history, ये इसलिए किया कि many people abused this system before, because in the governments before there was a list of the countries which have safe list and which has yellow list or red list. So the people made a travel plan or pattern to their destinations and coming back from the safe countries list so that they can show, oh, they do not need to do quarantine, or they do not need a negative test reports because they're coming from the safe country. But actually they were not. They were actually making a travel plan, and the travel agents helping them, and they actually themselves booked the travel through that via airlines, which goes from Turkey or any European country or anywhere of the safe country list. So to avoiding that abuse, they added this 10 days travel plan. So मेरे ख्याल में मुझे अभी quickly एक break के लिए कहा जा रहा है, तो let's go on break, and after the break we will have a 15 minutes. In that 15 minutes we will carry on our show on the other important issues. Please, ladies and gentlemen, stay tuned. We are having a short break.
If you want to advertise your business on Revive FM, then visit www.revivefm.co.uk or contact our sales team now on 07944 565616. That's 07944 565616. Advertise with Revive FM.
People of Asian and Black ethnic origin are at an increased risk of COVID-19. Queen Mary University London has launched a research study called Covidence UK to find out why this is. If you are Black or Asian, we need your help to complete our studies. All you need to do is complete an online survey. Please help us to understand the coronavirus disease so we can develop tools to prevent it. Sign up at qmul.ac.uk/Covidence. Sign up and save lives.
The new variant of COVID-19 is spreading fast. Around 1 in 3 people with COVID-19 don't have any symptoms but can still pass it on, putting people at risk of serious disease and renewing pressure on our NHS. Vaccines give clear hope for the future, but the rising infection rate requires action now. Once more, we must all stay home. If it's essential to go out, remember, wash your hands, cover your face, and make space. Stay home. Protect the NHS. Save lives.
This is Aisha. Her father died in an accident at a very young age. She lives with her mother and siblings. There are millions like Aisha who do not have access to the very basics of life, resulting in her and many others not being able to attend school. Through Minhaj Welfare Foundation, your charity is dedicated towards supporting the full needs of orphans and needy children around the world. Donate today. Call us now, 0300 30 30 777. Or visit us on minhajwelfare.org.
With over 40 years experience in the industry, Plachette Carpets is the place to go for all your carpets, laminates, linos and wood flooring. We have an established network of suppliers, which means we can offer some of the best prices in town. We offer free estimates, free measurements and now even free fitting. Call us now on 0208 472 8568 or visit us at 157 Plachette Road, Upton Park, London, E13 0QZ.
Could you look your family in the eyes and tell them you're going out to exercise, not just meeting friends? That you only ever leave home when you really need to? Do you always keep a safe distance and wash your hands the moment you get back? Around 1 in 3 people who have COVID-19 have no symptoms and are spreading it without knowing. Sticking to the rules stops the spread. Stay home. Protect the NHS. Save lives.
Cllr Plumbing, the boiler specialists. We do new boiler installations, full house central heating systems, underfloor heating, boiler repairs, boiler servicing, and gas safety certification for landlords. With some of the best prices in town, there's no job too big or too small for our qualified engineers. For a free, no obligation quote, contact us now on 07956 282 948. Cllr Plumbing, the boiler specialists.
Revive FM
94.0 on the radio,
on your mobile,
and online.
Very welcome back, ladies and gentlemen. You are watching and listening Your Voice with Muazzam Ali Sandhu, and we are having our distinguished guest, Councillor Qaisar Abbas, the councillor from West Thurrock Council. He is sharing all of the informations, advices, and the guidelines for our listeners and the community members. Qaisar bhai, I want to highlight a very important thing during this segment. We have until 7 minutes, so I'll open up a few discussions, and then I want you to respond thoroughly for the security of the people and safety. The issue is the crimes during this lockdown. There's so many bad news we have received. बेशुमार लोगों के साथ robbery हुई है. One of my friend, I was reading his post. I haven't contacted yet to him. He said in Forest Gate, उसके गर्दन के ऊपर चाकू रख के उसे पैसे लिए गए. He was threatened to be killed by a man. और इसके अलावा 1 14-year-old girl was raped in Goodmays Park. A white man was there who grabbed her into the bushes while she was on her exercise. That is one of the very sad incident. इसके अलावा there are so many online crimes are going on. People's money during this very difficult time is being robbed by the online scams of crimes. Fake emails being spreading and sending to the people, pretending that this email is from the NHS and vaccinations booking exactly. And also most of the important people who are living here in the UK, their fake Facebook accounts has been created in order to get the financial benefits from their friends and family. So there's so many things I want to share with you, but I think you must be aware of all of these things. So what is your comment on that, and what things our people need to do?
Obviously, this is very unfortunate. Some of these criminals, they are exploiting this situation when they know, people are already suffering, mentally. There are high death rates. People are confined to their homes. There are less income. So obviously, these criminals, they have come up with new ideas, to do their criminal activities. So obviously this is condemnable, whatever they have done, these criminals, So this is the police department's responsibility to protect these people. But online and on social media, there have been more criminal groups active now than before, and there are higher rates, so they have come up with very unique ideas. For instance, they are sending emails pretending they are from NHS.
Yes.
So, or they are personating someone on social media. For instance, they can say they are me or you or someone else, and they are asking money from other people. Or there are also kind of love traps where some individual, they are pretending to love or like you, and they are then asking you for money. So there are different kind of criminals who are actively, but their sole aim is to get financial benefit out of this. So whoever is asking you for instance, if you are receiving an email from NHS or from HMRC or from any other department or for police department, no one will ask you for your personal bank details or your credit or debit card details. No one will ask you in email about your date of birth and these key information, for instance your card pins or your account numbers or details. So be vigilant. Obviously these are very difficult situations. Sometimes they are very kind of convincing, the way they send these emails. It seems like they are from official departments. For instance, I even have received a message yesterday asking me to pay £2 and something. Even it seems very small amount of money. They are asking, okay, you have unpaid postage, which is around £2 something. So please contact on this number and make arrangements. Otherwise, a strict action will be taken against you. So we need to see, either are we expecting something from someone? So I know I'm not expecting something from anyone, and this is Councillor number. So if someone is sending these emails, so I have to be very, very careful on clicking these links, on calling on those certain numbers. So always you need to make sure where you are sending your details, with who you are sharing with your details. If you are sending money, make sure you know this person, not on through social media, you have met them and these things. Or if you're helping someone, obviously we shouldn't be shy away to help people who are in need, but at the same time we need to make sure these are not the criminals who are exploiting these situation, or they are exploiting your kindness and taking advantage of these things. And when it comes to, and even there are some people who are doing fake vaccination. They are going door to door offering this vaccination for money. So the government or NHS, no one is offering this kind of service. All these vaccinations, they are free, but they are being done through NHS, which also means your GP. So you should also contact your GP or NHS on 111 if you are suspicious of anything. No, if someone is coming to your door asking you, okay, we are having this vaccination, but you need to pay a certain amount of money. No, it means this is hoax. You need to report these kind of activities.
Exactly. And Qaisar bhai, I want you to comment on that because nowadays a lot of people relying on the items through the delivery because stores are closed. People buying things from eBay, Amazon, and other online stores like PC World, Argos, or many others, John Lewis. So the thing is, this is very easy for burglars and for the criminals to enter in someone's house pretending that they are here to deliver something. And if any old people or a child or a female open up the door, they are in a vulnerable condition and these criminals can't nick into their house. So what are the advice for the community in terms of that?
Obviously, Muazzam bhai, as you know, I'm not an expert in these security, matters or these kind of things. Yeah, personally, for instance, if someone will ask me, like, okay, we are like, are you expecting a delivery? So I should know, have I ordered something? Or have someone send me something, so I would be vigilant. I will look into these things. So if I'm not expecting anything, if I haven't ordered anything, so if someone is claiming, okay, we have a packet for you or we are some delivery for you, so I need to make sure who these people are, and I wouldn't be opening my door to these kind of people. So this is kind of like common sense. We need to make sure. Sometimes obviously this is
the door. Yeah, children shouldn't open the door. Sometimes children become excited, they open the door for everyone.
Obviously, this is parents' responsibility. Obviously, we individually, or personally, I wouldn't be able to advise on these things because these are very sensitive matters. We are not kind of experts on this. Like being a political person, a political worker, what we can do is like, we can request our people, like, to stay safe, stay vigilant, and look. For instance, if you see or if you are suspicious, report these things. There are nothing wrong in reporting these, and especially in these days, this is very easy to report. Metropolitan Police or Essex Police, they have, you can report these things online. Even there are chat system, there are calling numbers, so you can call them, but don't call on 999 if it's not urgent. Obviously it will add up the burden.
Kaisar bhai, we have end of our show. You have 30 seconds to deliver any message for community.
Thank you. First, again, I thank you and Revive Radio, for giving me this opportunity and for highlighting these things. When it comes to vaccination, please don't hesitate. Whenever it is your turn, step forward and get this vaccination. And if you know someone who is undocumented and who is scared to come forward, please encourage them. Contact your GP, contact NHS on 111, and then get vaccinated. And at the same time, be vigilant from these fraudsters and make sure you and your family stay safe.
Thank you so much, Kaisar bhai. Really great to have you in our show.
Thank you.
Thank you. Thank you. Thank you very much, listeners. This is the end of our show, and hopefully you enjoyed it. This show will be telecasted regularly during the week. See you next week. Thank you very much. Stay safe.
Could you